Was that everything you wanted to say about the lips before we go on to tear troughs?
So probably since we see a lot of people out there who are non-doctors, I would like you to also say that what you could do at home for your lips is make sure you use a lot of cream. So that stops the creasiness in the first place. So whatever cream goes on your face, whatever is your night care cream, please apply it on the lip. You don't want to have to wait for a special lip cream that always hydrates your lip and helps the collagen and the moisture stay good. Use a little scrub on your lip. That's something that you can do as well. Could be simply sugar and honey at home. So these things really help a long way. So that's about it. And when you go to inject your lip, please choose your doctor well. This is a place where you shouldn't be looking for bargains and look for an expert. That's important that I want to tell you.
Totally. I couldn't agree with that more. But so many people in the UK, I'm sure it's the same with you, they want a bargain. They say, why should I pay prices for in the UK?
Yeah.
And I can go down my local high street. You think because they don't have the experience, they don't have the techniques, they're probably using dodgy products because the products be controlled in the UK. They'll inject them wherever. You could get an occlusion, a vascular occlusion. You could get necrosis. Then if you go to the hospital staff are not trained to recognize aesthetic complications because it's not part of their work. And the practitioner just says, oh, it's a bruise, and it's not. You could be in real trouble. And all that becomes very expensive emotionally as well as financially, trying to find somebody to. So yeah, it's just not worth it. More questions around skincare. Right, let's go on to tear troughs.
Tear trough.
So when we talk about the whole tear trough area, I mean, there's a lot that can be going on there, isn't it? You have eyes that can be hollow or baggy, or the skin can be in festoons, or it can be swollen eye bags. I mean, how do you begin to differentiate all these things before you start to treat them?
So yeah, that's where your skill as a practitioner comes in, or your experience as a practitioner comes in. So let's split them into three categories. Like you said, one could be just a structural hollow, which could be by birth. It could be the way your eyes are structured. It could be the way your skin has always been. So it's just a structural depression, which is the tear trough now. A simple thing for that is just an injection of filler in that area, judiciously done by an expert. Voila, there is magic created. And scenario two is you do have a slightly aging skin. So you have a tear trough combined with a festoon. When I say festoon, I mean to say that, you see that little mount that happens to people, especially increases on the day that there is water retention. And as if there's an island with attachments of skin all around like that. So that's what we call as the malar festoon. Now that again happens because of the attachment of ligaments around a pocket of fat, muscle, and tissue. So there are two ways of dealing with it. Either we end up also dissolving the tissue there, the fat in that area. You can use like any of the energy-based devices we were talking about earlier to kind of tighten that skin on top. And then I use a filler to go all around the festoon to kind of make that surface more even. Now, the third case is having an eye bag with the tear trough, which is a nightmare, to be honest. Mostly that's a surgical case. I end up referring them to our surgeon colleagues. But in case you still want to not do surgery and do something non-surgical and injectable, then you try to be, firstly, as a doctor, of course, we try and look at it, whether it is water or it is fat, which is causing the bag. And then we would also go down to their medical history to see if they have any issues with the hormones like thyroid, or do you have any other issues like probably liver or kidney issues. So we end up looking at all of that and making sure you're at the best health. And then we aesthetically address that portion by very judicious injection of fillers just underneath or below that, tracing it. So the bag and the cheek now are not two different surfaces with a trench in the center, but you're filling the trench so beautifully that they at least look like one surface. But there you need to be judicious and see how much you can, but not overfill the cheek that you make the eye not openable. So that's something that we don't do. So therefore, again, the experience of your doctor, the finesse of the injecting hand, all this comes in a picture.
Yeah, terrific. Thank you so much. It's such a complicated area. It's again, it's very easy for it to go wrong if it's in the wrong hands. I know people that they're going to be left with that kind of sausage effect.
Yes.
When the trap between the muscle and the ligament and
like a bluish sausage.
Yes, that Tyndall effect
Yeah.
where
Yes,
making them.
exactly. Yeah.